Thank you everyone for being here today. Today, Salt Lake County is bringing online 37 new residential treatment beds for eligible individuals who have been arrested during Operation Rio Grande. So as we speak right now, a team of more than 40 professionals, including lawyers, social workers, and criminal justice employees, is at work in the county jail today, identifying and assessing some of the people who are incarcerated there. So we've talked a lot about phase 2. This is phase 2 in action right now. In fact, McCaye Christianson, who you'll hear from in a little bit with our Legal Defenders Association, has been down at the jail since 6 a.m. along with Noella Sudbury, my criminal justice advisor down at the jail, observing this assessment that started today at the jail. The goal of this assessment is to determine who is eligible for the new specialty drug court, which will meet for the first time next week. So these are the first new treatment beds available since Salt Lake County came forward a year ago with 63 residential treatment beds for Operation Diversion. Those 63 beds remain fully utilized, with many individuals remaining in and completing treatment. I'm sure that these new 37 beds will be filled with eligible individuals in a matter of days, and so will the additional beds that we bring online in a few weeks. Public safety in the Rio Grande area, including less crime and fewer victims of crime, is one of the reasons for this remarkable partnership between city, county, and state leaders. And the results of this partnership are obvious. Much of the chaos, lawlessness, and danger is subsiding. However, everything we have learned after years of trying to address these problems tells us that we cannot arrest our way out of this problem. The short-term gain of locking nonviolent people up brings long-term pain, as the fallout from merely arresting people and jailing individuals plays out in our community. These emotional and the emotional and financial burden of substance use disorders can fall heavily on families and friends of those who battle addictions. Society also pays through increased crime and increased costs to taxpayers to prosecute and to incarcerate those individuals. We know from many studies that treatment programs can reduce costs, both the human costs to individuals and families and costs to taxpayers. As the county mayor, charged with delivering vital behavioral health and other services, I am responsible for understanding and getting to the root of the problem and then implementing solutions. One thing we have learned from Operation Diversion is that for many individuals who were offered diversion instead of jail, more structure was needed in order for them to succeed in the program. That's why my team, collaborating with the state, has proposed the new specialty court. Screening for this new court program is taking place today in the jail, which has never been done before. And in less than 14 days, eligible individuals will be connected to a structured treatment program. They'll be assigned a case manager, a peer mentor, behavioral health treatment services, and a specially trained officer to help them stay engaged and to be held accountable. And we believe this additional structure will help more individuals succeed as treatment resources are offered to them. We've had 2 judges volunteer their time, and also one who was willing to come out of retirement to help meet our aggressive timeline with this new court. Those participating in the drug court program will be eligible for Medicaid, assuming that the waiver is approved. There have been legitimate questions about the costs associated with Operation Rio Grande. Research shows us the path towards reducing costs must be a path that provides access to treatment. For 20 years, we've known that substance use and crime go hand in hand. Nationally, 1/3 of property offenders say they've committed crimes while under the influence of alcohol or drugs. Studies repeatedly show that more access to treatment for substance use disorders reduces crime in our communities. In short, for every dollar that we spend on treatment, up to $3 are saved in crime reduction. I know Sheriff Rivera, who we'll hear from in a moment, she'll speak more about what she expects this to mean in the jail. Shawn McMillen with First Step House will speak about how access to treatment affects individuals' lives and outcomes. So before we hand it off to them, we'll also hear, as I mentioned, from McCaye Christianson with the Legal Defenders Association and Major Jess Anderson with the Utah Department of Public Safety. But before I hand it off to them, I also want to let you know we'll have two recipients of treatment here at First Step House who will be available for comment, and they'll be near Michelle. I don't know if they're out here. Look for Michelle, and she'll point you out to them. It's Kurt Landenberger and Ray Dumar. Thank you to them for being willing to open themselves up and to talk to the members of the public and the press about the importance of treatment. I want to thank everyone who has made this possible. Today, we are beginning to fulfill the promise of the Justice Reinvestment Initiative. We're beginning to see that meaningful reinvestment in treatment that we know is critical to public safety. We're beginning to see the meaningful investment in treatment that we know is critical to public safety, a more efficient use of tax dollars, and meaningful and measurably better lives to people who seek recovery and a return to self-reliance. Thank you. Sheriff?
Good afternoon. Thank you for having me. My responsibility as sheriff is public safety, and that is one of my biggest concerns. I believe that jail space should be prioritized for the most violent criminals. However, there are many individuals who we arrest every day who really don't need to be in jail. They could be better off with treatment. That includes drug and alcohol addictions. These are the ones that I believe that will stop the revolving door from occurring if we can help them. With Operation Rio Grande, we have arrested approximately over 1,000 people. Many of those folks have been released already, and we will see them at our doors again, unless there's an alternative. So I do believe in what the mayor is saying. This treatment is going to help us go down a different road with those folks. Our staff, our deputies and our civilian staff have worked very hard for many, many years to provide the best care. However, the best care sometimes isn't jail. And with this program, this will help those to get treatment and get help and maybe not show up at our door again. We've taken several steps to ensure that the jail is still receiving criminals, and that is our biggest priority right now, is to take the most violent criminals off the street and put them in jail. I appreciate that Salt Lake County is committed to be balancing both the need for treatment and also the need to house criminals. We have at the jail, we also have our CATS program and our intensive supervision program, and that is our probation program, where we actually follow these folks with their case management, treatment, and law enforcement supervision. I do believe that the Justice Reinvestment Initiative is going to be effective. However, we have to have that balance between treatment and jail space. So the success of Operation Rio Grande really depends on those two things. And I do fully support today what the mayor is saying on this treatment program. I did visit the jail, and right now everything is flowing well, and we hope that those beds can be emptied out of the jail and the treatment beds full very quickly. Thank you.
Good afternoon. At Salt Lake Legal Defender Association, our mission is to fight for the rights of people accused of crimes. Often that fight requires a holistic approach to addressing the diverse needs of our clients. We are committed to facilitating our clients' access to substance abuse and mental health treatment services as a core value. Every day we are reminded that people experiencing homelessness are not outsiders. And I see my role here today as being someone who works with and knows and appreciates and is in a position to represent the people who are the subject or the target of Operation Rio Grande. And I understand, and I think most of us here understand, that people experiencing homelessness are part of our community. There are friends and acquaintances. In some cases, there are parents, our siblings, our children. Some people experiencing homelessness also struggle with addictions and untreated mental illness. We know that homelessness, mental illness, and addiction are adverse circumstances that can arise in anyone's life. The people addressed by Operation Rio Grande are part of our Salt Lake County community, individuals who deserve to be treated with kindness and respect. At LDA, we greatly appreciate the renewed community interest in serving the needs of people with addictions and mental illness who are also homeless. On behalf of our clients, we're thankful to Mayor McAdams and the County Council for making a financial commitment to treatment resources. We are optimistic that many of our clients will receive much-needed services through Operation Rio Grande. We know from decades of experience that no amount of money spent on jail cells can solve the problems faced by people with addictions and mental illnesses who are homeless. Public funds are much more wisely spent on treatment resources, which hold out real promise for reducing crime, preventing recidivism, and producing better outcomes for individuals and families. We and our partner agencies are also acutely aware of impediments to meaningful treatment, which are pervasive in this highly vulnerable population. Lack of housing, lack of employment, lack of health care, lack of transportation, and lack of other basic necessities are factors that can seriously compromise the long-term success of treatment. We look forward to collaborating with our community partners not only in assuring appropriate treatment placements, but also in dismantling these impediments to success. We at LDA believe in and are working for the future wellness and happiness of our clients who will have access to treatment resources through Operation Rio Grande. Thank you.
Mayor McAdams, members of the Salt Lake County Council, Sheriff Rivera, McCaye Christianson, friends and guests, thank you for joining us today. Thank you for your hard work to address this serious health crisis. Thank you for your courage. Thank you for stepping up as leaders to bring this phase of Operation Rio Grande, the treatment phase, to fruition. Established in 1958, First Step House has become a data-driven substance use disorder treatment provider, offering a continuum of services that range from evidence-based residential and outpatient treatment to housing, intensive case management, wraparound services, and long-term recovery management. Our services are designed to help people sustain treatment gains as they transition and stabilize in the community. During my tenure as executive director, I have witnessed the outcomes for people unable to access treatment, people living on the street as they wait 6 months to a year to receive the treatment they desperately need. For most people, their condition worsens, and some, sadly, never make it into treatment because their addiction leads to death. I've also witnessed the impacts of evidence-based programs like drug court and access to treatment on demand. We know these best practices are effective in helping people address their substance use disorder and breaking the cycle of criminal recidivism, rebuilding their lives, reconnecting with loved ones, finding employment, and contributing significantly to the community. So you can imagine how excited we are to be a part of Operation Rio Grande. This phase of Operation Rio Grande provides an opportunity to increase collaboration between behavioral health and criminal justice systems. One result of this collaboration is a new diversion court that will help people access treatment quickly without the current burden of waiting for months for treatment. It will also increase access to medication known to be effective at retaining and sustaining treatment gains for opiate-dependent persons. As a community-based organization founded to address just this problem, the problem of high-severity substance use disorder and homelessness, we were involved in Operation Diversion. Many of the men that we served in Operation Diversion came to us directly from the street. First Step House counselors and therapists described the condition of many of the men that we served in Operation Diversion as similar to the condition describing people exiting conflict zones, war zones. Several men shared bits of their stories with me, and it was bad. Stories of feeling trapped and beginning to believe that the environment they lived in, the environment of drug use, severe violence, poverty, and sickness was normal. We were working together to help people the people trapped in the cycle of addiction and incarceration. Thank you, Mayor McAdams, Sheriff Rivera, and members of the Salt Lake County Council for your support and commitment to Phase 2.
Good afternoon. My name is Major Jess Sanderson with Utah Highway Patrol and the Department of Public Safety. We're excited to be here with this Phase 2 step and being able to make that transition from Phase 1 to Phase 2 and knowing that these treatment beds are going to be of great value to us. By way of where we're at as far as our numbers of what we're looking at with Operation Rio Grande. To date, as of this morning, we have had a total of 1,023 jail booked arrests. Of those, 180 of those are felonies. 843 are misdemeanor. We have a total of 2,175 warrants that have been served or taken in. And of those amount of arrests, we can report that we have only had 8 cases where a use of force has been used. Of note, as far as the and playing into Phase 2, there have been a total of 1,716 offers for services from our officers through this collaborative effort, working with our partners of Salt Lake City, UPD, AP&P, offering those services. 618 of those services have been accepted from individuals that want this treatment, that want to find a bed to be able to get better. We thank those providers and those who are able to do this. We understand on the front line that this is what's going to make a difference for us. To give you some sort of perspective of that as well, earlier this week we ran some numbers of 966 arrests at the beginning of this week. Only 57 of those individuals have been arrested twice from down in that area with Operation Rio Grande. Six individuals have been arrested 3 times and 2 individuals have been arrested 4 times. That goes to show you the number of treatment beds that need to be available to help these individuals. We're excited to have that come available now and move into that phase. Thank you.